Hi, I'm Chandler Johnson, and this is my Psychology 410 term project. I chose the topic, the effectiveness of music therapy for treating depression, because I want to be an occupational therapist and I've witnessed sound therapy, and so I thought it'd be interesting just to kind of learn the difference between sound therapy and music therapy. So before we get into what music therapy is, I want to talk about what depression is and get a better understanding of it. So, depression is the feeling of hopelessness, extreme sadness, being withdrawn, the inability to experience pleasure, and having low self esteem. It affects up to 322 million people worldwide, which makes it one of the most common mental illnesses. So, I wanted to talk about different causes. One that people are probably most aware of is genetics, so that would be getting it from anyone you're related to. Biochemical would be having low activity of two neurotransmitter chemicals, which are known as norepinephrine and serotonin. Immune system, when your white blood cell count is low and you're more susceptible to diseases that can lead to depression. And then brain circuit dysfunction can lead to specifically unipolar depression. And depression affects your behavior, motivation, emotions, cognitive ability, and your psychological ability. So, moving on, what is music therapy? I found this quote from the American Music Therapy Association, and I thought that it explained it best. So, it's the clinical and evidence based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional. So, that would be anyone who has a license in music therapy. And then I found this photo, which is a nice visualization. I thought it explained how music therapy affects the brain and kind of tied in psychology. So if you look at the picture, you can see that it affects corpus callosum, motor cortex, prefrontal cortex, amygdala, cerebellum, visual, auditory, and sensory cortex, and then the hippocampus. And then I went into the history of music therapy. So it dated back all the way to Plato and Aristotle, who recognized that music had healing powers. Then it became popular again after the World Wars, and they would invite musicians into the hospitals to play for people. And then they kept inviting the musicians back because it had such an effect on the emotional trauma that the veterans experienced. And finally, they started a degree program in 1944 at Michigan. And then years later, in 1998, the American Music Therapy Association was founded. This educates, trains music therapists, and promotes music therapy. And right now, there's about 4,000 members. So tying back into depression, basically for music therapy, someone with depression would have regular meetings with the musical therapist because it's known to decrease depressive symptoms and it improves mood through emotional expression. Some of the treatment methods that are popular is group therapy / talk therapy, and that is when not only are you on an individual level with the music therapist, but you also have peers with you, and that kind of ties in like the socialization aspect of it. And then a big thing was rhythm, slows down breathing and heart rate, so depending on what music you're listening to, it could be very therapeutic. And then I wanted to touch on that the type of music depends on the patient's needs, so not everyone would be listening to the same type of music or creating the same type of music. And then there's two different types of music therapy. The first one's called passive, and so that's basically just listening to music, but also while either meditating or doing a reflective activity such as drawing. The next type is called active, and that's when the person is actively creating and making music, but also while sharing their thoughts and feelings. So these people can communicate through music instead of words. That helps a lot of people who have a hard time expressing their emotions, and it gives them the opportunity to create, which creates purpose for them. and it stimulates specific emotions that the therapist is trying to touch on. And like I said earlier, it gives them a social aspect and helps people with depression who are withdrawn kind of come back into society and be present. And then I came across a study that was comparing music therapy to psychological treatment, and they were specifically using both active and passive therapy, like I mentioned. And they found that music therapy with psychological treatment was the most effective. So people with depression probably wouldn't just have music therapy, they would have it with psychological treatment. But they are still researching and finding the best treatments for people with depression. And I just wanted to list out the effects of music therapy because it has such a positive effect on people with depression. So here are some of the effects. It includes reduced muscle tension, increase of self-esteem, which is great because people with depression are known to have low self-esteem, decreased anxiety, and I believe anxiety and depression go hand in hand, enhanced interpersonal relationships, which is great because I know that depression affects a lot of interpersonal relationships. And then it increases motivation and helps them in their jobs, daily life, and then it gives them a safe place to release their emotions and work through them. So then finally, I have my reference page. So thank you for listening.